So let me take you through certain tools which are needed for reduction and maintenance of reduction in acetabular fractures. We'll just take this example of a posterior column fracture patient in which you can see it's a classical posterior column which is fractured out. So the posterior column being formed by the ischial tuberosity, the ischial spine, and the posterior 1/3 of the weight bearing area. So this is what is the reduction that you would be trying to achieve, and there could be various tools which you can use in getting this. So I have pre-drilled a few screws and few holes to make this a better understanding. And if you can see at as in this fragment, you have various parts where you can get a control. You can get a control in the ischial tuberosity area. You can get a control in the posterior column, but you need to be careful that you don't end up inside the joint. So I will first use a simpler reduction clamp, which you might be knowing, you must have looked at. They come in various sizes and they could be straight or angled. So I've chosen this particular angled straight one, which you can actually use in the posterior column. So you need to understand that there is space below the ischial spine and above the ischial spine to erase your soft tissue and then get in your spikes over there. Once you've got in your spike over there, you can actually pass your finger and then guide your ball spikes inside between your finger and your bone. And once you get a hold, you can get your finger out. So this is one of the tricks which can be used both in the greater sciatic notch as well as the lesser sciatic notch. Pass your finger and then just pass your tongue in between your finger and the bone. I hope you got this. So let's just manually get this reduction. So these things are easier done on sawbones as compared to what you do in life, but then to get yourself oriented, I think sawbone is not a bad idea. So we just got a simile of a reduction over here, and then what we do is we've already cleared the soft tissue down there, and if you can see, I've drilled a hole on the top which will facilitate the reduction clamp to stick there and not slip when you tighten it. So we open the clamp to the maximum, we pass it in the lesser sciatic notch, we get a hold over there, and then we gradually try to get the outer prong into that hole which we have created. So these are two very strong areas in the iliac bone where you are always going to get a good hold unless you have a fracture over there. So I hope you have understood this one basic way of reducing a fracture of the posterior column, and this is a very simple reduction clamp which you need to understand how to pass it in the lesser sciatic notch and then how to get a grip on the top. So you can see two screws over here. Now this can be another way of getting a reduction when you're struggling or when the forces required are larger, the patient is large, or the fracture is a bit lowered. Then you can use this type of a reduction clamp. Now this you can see has two holes over here. These holes are for screws to be put. So a screw goes there into the bone, and then you use the clamp to either sort of distract first or get it down. Now invariably you use the outer fulcrum so that you have a gap in between, and you can place your screws slightly away from the fracture. And again, you have to be very, very wise about placement of these screws. They should ideally be as perpendicular to what you want to achieve. So now in this example where we are trying to get the posterior column right, one tip is that always try to go on the posterior aspect. This is the area where the bone quality is best and you can get your screw hold very good, because you remember you need to apply force on these screws to get the reduction done. Second thought is that you need to leave adequate space anteriorly so that after the reduction has come, you can apply your anterior plate. And the third thing is, now these clamps can be applied like this, or they can be applied like this. So it's always better that you place them posteriorly directed so that you have adequate space for the anterior placement of the plate. So let's try and use this clamp and see how well we can get it there. So again, open it up completely and manipulate your clamp so that it gets into the screw hole, into the screws. It's not a bad idea to check the screws before you are sort of using them, that they are holding in the reduction clamp. So you can see that we have to actually slightly manipulate the clamp to get the screw into the place that we want. You might have to loosen the screw or tighten the screw. So once you've got your clamp in position, as you can see here, you might want to tighten the screw a bit. So once the clamp is there, you can tighten your screw and the clamp will hold. So let's put it again. So there are advantages of saw bone, there are disadvantages. Disadvantages, there are no soft tissues, so the pieces are almost flying here and there. So I got it there. So I got the clamp right in the screws, and then I'll just compress it. You can actually use it for distraction also when the reduction is a bit malaligned, and once you got your clamp tightened, the reduction would come beautifully. See that? And once you've done that, you can actually try to attempt and put your anterior plate. So once you've got those screws in the clamps, you can tighten the screws a bit for a better hold of the clamp on the bone. There you go. I hope you can watch the fracture getting reduced. You can still tighten it a bit, and there should be a balance between, you know, getting the reduction and crushing the bone. And once you've got that reduction, now you know that you can easily put your anterior plate, which I've already contoured for you, and you can see it sits beautifully. It sits beautifully on the ischial tuberosity, and it goes supraacetabular. So you have good 3 screws proximal to the fracture, and you can get good 2 screws in the ischial tuberosity, and you can actually just leave 1, 2, 3 and 4 screws in between. Once you put this plate of yours, then you take out this clamp and put your second plate on the back. So I hope this reduction tool is understood by you. Thank you very much.